thank you very much. And an important part missing from that introduction was that I'm also actually a patient myself. So I've got a personal and a professional interest. I have lupus, Sjogren's and Addison's, and my family has a host of autoimmune diseases. So I'm going to have three main parts to this talk. I also presented several sessions this week at the British Society for Rheumatology. And some of these slides, you'll think they're quite clinician-focused, but I want to show you what we're trying to teach the clinicians, things that are so important from the patient perspective. So I'm going to talk about neuropsychiatric symptoms. So that's a mixture of sort of the mental health symptoms you'd be familiar with, and then the neurological, so things like the tremors, the tingling in your fingers, the difficulty swallowing, and the impact it has on our lives. Why we find it so difficult to talk about mental health, why our doctors find it so difficult to talk to us about that, and the impact that our doctors have on our mental health, both positive and negative. So that's something I am passionate about changing. So apologies in advance for this. I found this very upsetting. I'm an ex-military officer, so I think I'm really tough, but some of this made me cry. So we just asked at the end of one of our surveys, hopefully some of you have completed these surveys for us. At the end, we just said, how's your disease affected your life? And we got really long essays sometimes. And at the end, some people said to me, well, thank you for caring. Thank you for asking. And it was really just a question on a survey. So it made me realize that people really aren't being asked this. And then we did some in-depth interviews as well. And you can see here, it stops me living a life. It stops me having the life I would have had. I'm grieving for the person I was. I'm grieving for the life I would have had. And one of my lovely colleagues put together this layers of complexity about how it actually, right in the middle, affects how we see ourselves, who we are, our whole sense of self. So that outside, someone earlier mentioned, it's quite invisible, some of our symptoms we have. I mean, with scleroderma, sometimes you will have more visible symptoms, but some people won't. And that they interact, they're complex, we don't always know what's happening when, and it changes our relationships with people, friendships. Some of the saddest things for me, when we did this survey, I said to people, could you then send a survey to some of your healthy friends, because we need a comparison group. Some people came back to me and said, I really support your research, but I haven't got any healthy friends left. I've lost them all because of my disease. And the participation, we can't participate in the things we used to enjoy, things that give our lives meaning, and that middle bit, again, affected by doctors, sometimes positively and negatively, that self-doubt and how we feel about ourselves. So we really need to work hard to improve that for people. So this was a study we did on, so it's the mental health and the neurological symptoms. You can see the list of symptoms down there. I don't know how many of your doctors ever ask you about these, even with a disease like lupus, which is known to affect the brain. Very few are actually included because people don't always ask the patients. Some of these guidelines were decided in the last century when it was quite a paternalistic health symptom. Patients weren't involved, so we went out to the patient groups and said, tell us what you're actually experiencing rather than what you're told you could be experiencing. So we got this list of symptoms, which is just a few. And you can see the red lines there. That's the percentage of people so it's all the systemic autoimmune rheumatic diseases, which is scleroderma, lupus, Sjogren's, all those types. And you can see against the healthy people, which is the black line, it's almost double, sometimes more, all of those symptoms. And you'll see in those symptoms, there's things like disorientation. So people said to us, oh, I feel this kind of spaced out feeling, which no one really talks about, or the lights and the noises really make me feel overwhelmed. So there's a lot of symptoms, and if you are experiencing any of those, or all of those, do never be ashamed of those. It's part of your disease, it's part of living with a difficult disease, and we just need to talk about it more. So we also asked people of the impact of the symptoms. It's probably no surprise to you that fatigue is right at the top. So you've got there, the blue is how often people experience those symptoms. So it's between 0 and 4. 0 was never, 4 was always. And how bad that felt when you were experiencing it is then the grey line. And then we multiplied those together. So you can see the overall impacts. You can see fatigue, not being able to sleep, the brain fog you get. So this is only neuropsychiatric. We haven't included things like pain and many of the other symptoms. So you can see fatigue is massively impactful. So we're working now on studies that will actually help people adapt to living with those diseases. As you heard from the professor before me, there's little actual well, there are treatments, but we can't completely cure these diseases. So we need something to do to help people live better lives. There's a really high burden of mental health symptoms, fatigue, poor quality of life. People aren't participating. The lady before me was saying about making friends with people who really understand, who've got the diseases. And clinicians are genuinely very well-meaning usually, but they just don't have the time. They have 10, 15 minutes with patients, so they can't really always talk about these symptoms or help. So people need help to adapt. I don't know if any of you know the REM project. If you don't, really worth getting in touch with them. If you are struggling, as most people would be with these diseases, they offer just listening support, just that time just to talk about how you feel. Now, this is a poem one of our patient partners wrote about how she felt. I'll let you read the first bit there. But the bit that hits me every time she reads it, we present this to the doctors to show this impact. But I had been longing for a place to grieve, to weep my river of sorrows. So she was saying she really wanted somewhere to actually just talk about how it felt. And that wasn't being offered. So yeah, here's the REN. We actually trialled it just to see if it was having a good effect, and people found it very worthwhile. These were some of the quotes we get. I hold in my heart the kindness. This is the only space I've ever had to talk about lupus in a totally open and honest way. It was so refreshing. They were non-judgmental. I felt trust. I felt safety. So it's really worth doing that. Now, talking about mental health, we asked people how often they had told their doctors about their mental health symptoms. We asked the doctors, how often have you asked about mental health symptoms? A lot of the reasons why people aren't talking about it is because they've never been asked. So this lady with rheumatoid arthritis had been a patient for 30 years. And she said, not once has the doctor asked me about mental health. And then you've got this lupus patient here who said that she said to her rheumatologist, and he says, no, talk to your GP. And the GP says, oh, you're way too complex for me. The lady I'm sitting with there, we do not want to be told we're complex. We've got complex diseases, but we're not complex people. And you often have this whole host of doctors who are, we use the term ping pong ball patients. And I spoke to a lady with Sjogren's who said, I just feel like an unwanted pass the parcel. When the music stops, no one wants to be left with me. And how often are we reporting these symptoms? So you can see here, this is the percentage, sorry, I've made that a bit small, percentage of people who have experienced these symptoms and never, ever told a doctor. So at the top, below 10% have reported. So most people report fatigue, severe headache. Look at these really severe ones down here, which many of us will experience. The mania, the hallucinations, the delusions, up to 60 to 70%. So the doctors say, oh, with scleroderma, you won't really be getting those symptoms. But that's because we're not talking about them. So here's some of the barriers to why we're not talking about mental health. This is both the doctors and the patients. So most patients with these diseases have so many symptoms. You've probably written your list and thought, I've got 20 minutes, how do I fit in 50 pages? And I've got symptoms in all different areas of my body. So patients are prioritising and doctors are prioritising. They only have 15 minutes. And mental health often gets put to the bottom or missed. And we're trying to look at the reasons why both sides don't want to talk about it. And the biggest one was fear. For patients, I don't know how many of you have had difficult diagnostic journeys. People get told symptoms initially when it is quite difficult because you get different symptoms, you can't explain them, the doctors can't explain them. We have far too many people being told the symptoms are in their head, it's mental health, this is particularly high with women, it's psychosomatic. So people are scared if they say, oh, I'm having these mental health symptoms, that in the future the doctors will say, oh, well, that's probably mental health, and it might affect how they deal with your scleroderma. And the doctors are also scared because some of them have not been trained in this. If someone goes in and says, I'm feeling suicidal, I'm having hallucinations, that's their whole day taken up with having to deal with that patient, and then it has repercussions on every other patient. So it's actually caring for the patients in general, but they are also scared to talk about it. And there's still stigma. I think the newer generation are much better at speaking about depression and anxiety with each other, but when it gets to the more severe symptoms, there is still that stigma that makes us reticent. Rheumatology departments don't have many psychologists to help. And this is something we've done a lot of work on. as to how your experience is when you're being diagnosed can then affect you for the rest of your life. We've experienced this particularly in people who had symptoms as children. But yeah, it has big impact. So this is what I was trying to teach the doctors this week, is how can we talk about it better? Just ask. We just partly need to actually ask, and ask again. I think it's a very British thing to say, I'm fine, thank you, when you're really not. I was in hospital a few years ago. I had COVID, so I had viral pneumonia, bacterial pneumonia, fungal pneumonia, and meningitis. I knew the chances weren't good. They were going to move me to ICU. And the doctor came in and said, how are you today, Melanie? And I said, I'm fine, thank you. How are you? Clearly, I wasn't fine. And in that case, I had blood tests that showed I wasn't fine. I had machines beeping all around me. I looked horrific. But when I'm having a lupus flare, sometimes nothing shows I'm not fine. If I'm depressed or having hallucinations or whatever other people get with these diseases, it's only listening to me that will tell you I'm not fine. So you have to ask. So we told the doctors to do the ABCs. Be available. How many people try and get hold of their doctors? It's often not the doctor's fault. It's the administrators. It's the secretaries. You get bounced back. You feel really abandoned. I can't get hold of my doctor when I need them. Believe and listen. I have this coming in on the screen all the time to the doctors. You need someone to validate that what you're experiencing is real and serious. And try and build up that relationship. There's many, I don't know how many of you have got a really nice rheumatologist who you've built up the relationship with over years and you trust. But that's the important part there. And also normalise it. You've seen from our screen there how many people do get those symptoms. And the doctors should say to you, it is normal with your disease to have these symptoms. It might be the disease causing these symptoms directly, so inflaming your brain. There's a lot more being understood about that now. And it might be that it's a really difficult disease to live with, so it's very normal it would probably be abnormal to not feel depressed and anxious at times. This was a psychiatrist we interviewed who said, give time, space, and silence. And the rheumatologists said, well, that's easy for psychiatrists because they can sit there for an hour and say, how do you feel? And get to know the patients. Everybody has different symptoms that will come in their flares. So this is something we've been looking at, is the impact of someone who's been misdiagnosed, particularly if you're told that so the bold ones there are mental health, the stripy ones are psychosomatic, so patients often say, oh, I was told it was in my head. And you can see the different disease groups along there. So scleroderma is the one in grey. It's not at the highest. The ones with undifferentiated connective tissue disease more often get told that because they don't have very clear blood markers. But it's still really high for scleroderma. You can see nearly 40% of people have been told their symptoms were not related to their autoimmune disease, but related to mental health. And over 20% told their symptoms were psychosomatic at some time. And what impact does that have on people? So you sort of expect this first one that over 80% said it caused them to distrust their doctors then, but over 50% said it caused a distrust forever, which then affects how you talk to your doctors. This was a really sad point. Over 80% said it damaged their self-worth, again in the long term. And 72% said it still upset them now. I was interviewing people my age. You can tell I'm a long way past the teenage age. People who'd felt this, that they'd been told it was hypochondria or something in their teenage years. They were crying talking to me at the time, saying, I will never forget those words. It's damaged me forever. And this lady here said, my GP told me I was depressed when in fact I was having seizures. This has caused me so much stress and anger and upset. And these are the words we hear a lot. And this really important bit at the end, I have nowhere to voice this anger. We need to give people a voice. So that's what the REN does well. And also tell your doctors, this is how I'm feeling and this is why I'm feeling that way. And this lady, and this was really common as well, particularly those that had this happen to them as children, it makes you worry about the very essence of your character. I have no value whatsoever. So it's really important we get the doctors to work on this and we get the patients to actually try and recover from how that made them feel. So this is something we have lots of talks about. We have a very lovely multidisciplinary team, a lot of patients, a lot of psychiatrists, psychologists, rheumatologists. And we say, actually, what's more important? Is it your blood test? Is it something the doctor can see? Or is it what you feel and what you say? And often in medicine at the moment, people will say, oh, your blood tests are clear, and you think, oh, I'm feeling rubbish. And for us, actually, what matters to your quality of life? You can have great blood tests, you can look great, and I think people with these diseases often get told, but you don't look sick, or the doctor will write, Mrs. So-and-so looked well today, and you think, I didn't feel well. And if you've got neurological symptoms, if there's something they can't see, if you say, oh, my hands feel fuzzy, it tends to be psychologized, so if they can't see it, it tends to then be put in that bracket. And we found that we summarized it there with the diagnostic tests, verify, validate, and vindicate. But this was a neurologist who said that. They often don't show much. And this was a patient who said, when the bloods come back, you actually start to distrust yourself. I don't know if any of you have ever felt that. I've certainly felt it. It's like, oh, am I actually imagining this? But we aren't. Oh, yeah, this hasn't quite come across up here, but we're trying to train doctors how to write a clinic letter that is validating and helpful. So writing patient look well, or patient claimed, patient denied. The patient is not on trial. You wouldn't write the doctor claimed or the doctor denied. So it's just, this is quite a common one. Patient claimed to have joint pain, but there was no evidence on examination. So actually, are you saying what they're saying is lying, but actually it's just a subjective view? And the words like vague, non-specific, complex, how do patients feel about that? And this is what we found out. They're feeling not believed, they're feeling like they're a hypochondriac. Now that line at the bottom, nothing wrong with this woman aside from obesity and hysteria. You might think that was from the last century or 50 years ago. I asked on some of the patient support groups, what's good things and bad things that have been written in letters. And this lady actually posted me her letter. And she actually had severe eye damage, which was then vindicated by a ophthalmologist. So I think it's just really important to think about that. And if you get a clinic letter that you find invalidating, teach your doctors. They're still learning too. And they do genuinely and generally want to help and not cause damage. And then we've got some really positive points. So sometimes it feels like I'm bashing the doctors because we really want change and we want it quickly. But actually, some of them are brilliant. So this one here, this was a patient who said, the rheumatologist rang me. It wasn't even my appointment. She just said she'd been thinking about me and worried about me. I then realized she cared. And I kind of mattered. So that spontaneous contact of, actually, I'm just worried about this patient. But we also have to consider how busy the doctors are, and they've got 50 patients to get through, adding that into it as well. And this was a really nice one. She just kept talking throughout the whole interview how amazing her rheumatologist was. He just looked at me as if I was the only person who existed, and what you were saying was totally valid. I felt safe with him. And the downside of the really positive relationships that many people have with their rheumatologists is rheumatologists will retire. They will move hospitals. And this patient here said, absolutely devastated when she moved hospital. It felt like a bereavement. So it's managing that as well, that you get very attached to your doctors. So just to summarize there, the mental health burden is high. We don't talk about it enough. It can be a direct effect. There's a lot more knowledge now that actually these diseases do cause the inflammation, brains and bodies as well. But there's so many other causes, it's really hard to live with these diseases. We take medications, high-dose steroids can make you feel very odd. It can also make you feel very down. I mean, I've had a great big steroid face before and felt not very beautiful. And some people may have pre-existing conditions, and adding in that traumatic diagnostic journey that some people have had of not being believed, and that everyone should ask for and be offered that support. So really do consider the REN if you're having difficulty. And this is something you've probably seen going around the patient groups. I love to show this to the clinicians. We put up our hands for help, and the doctor says, yeah, your test results are normal, and you so slowly drown there. So the last thing that we tell the clinicians is just say, I believe you, and I'm here with you on this journey. So yeah, thank you very much.